All right, so when we're looking at psychopathology, we also have to look at the biological model, which is from a brain perspective, brain structure, brain chemistry, what's going on with psychological disorders, because it's not just, a personality thing, which also would be a brain thing. Like, it's always going to be related to the brain in some way. So the biological model of psychopathology looks at the biological changes related to mental illness. So the changes in the chemical, such as your neurotransmitters, structural, like are there actual structures in the brain that are different, or genetic systems of the body. So how much of different psychological disorders can be inherited and are genetically linked. So when we look at, pretty much any psychological disorder, we do find that there is at least some chemical, structural, or genetic issues kind of going on here. So as we go through the different psychological disorders that we're going to talk about in this chapter, I will talk about kind of, where are the kind of the genetic, chemical, structural differences that we see in them. So when we started talking about the brain all the way back in chapter 3, remember one of the things we talked about was serotonin and dopamine. And if you remember when I talked about serotonin, we talked about SSRIs, right, which are antidepressant drugs. It's because serotonin is a chemical imbalance in the brain that leads to depression and anxiety, right? Dopamine has a lot that it is involved in with psychopathology, right? Different things like that, structural components. There are different structures of the brain that can be smaller or larger in people with different psychological disorders. So for example, there's a part of the brain that people who experience PTSD tend to have a smaller part of that part of the brain is smaller in people with PTSD than people who don't experience PTSD. So it may be that from a structural perspective, your brain is has kind of a pre-existing condition. Whereas if this particular part of the brain is smaller than the average person, and then you experience a traumatic event, you're more likely to experience PTSD than someone who doesn't have or has a kind of a quote-unquote normal part of that brain. So that would be a structural difference. When we talk about schizophrenia, we'll see there's a very big structural difference in people who have schizophrenia, where their brains are significantly different and their ventricle size than people who don't have schizophrenia. And then the genetic component of this is huge. There's so many genetic predispositions that are out there for mental illness. So if your parents had it, your grandparents had it, it puts you at a higher likelihood of also having a mental illness. All right, so this is the Great Big Book of Mental Disorders that I talked about earlier. So this is the Diagnostic and Statistical Manual of Mental Disorders. So this is the this is the 4th edition. There's a 5th edition out now, but I can't afford it. So here's a picture of the 4th edition. This thing's like $500 some odd. But it's just a great big book, and it lists every single psychological disorder that we currently can diagnose someone with. And there's a whole bunch. There's like over 500 of them. And it lists what they are, it gives a description of them, it gives the diagnostic criteria, it lists here are the different things that the person needs to have. So it'll have like, 10, diagnostic criteria, and it'll say if a person meets 7 of these 10, then we can diagnose them with this. And the mental disorders are categorized by type. So there's personality disorders, there's psychiatric disorders, there's conversion disorders, all different types of disorders. If we ever get back to campus next semester and you're around and you want to come visit me, I always have candy, and I also have this great big book if you want to look through it. It's fun. It's fun to go through and diagnose yourself with a bunch of stuff, because you always can find stuff that you feel like, oh, I think this might be me. Everybody does it. And this is the book we use. So when we go about diagnosing somebody, we use a what's called a 5-axis diagnosis. So the first axis is clinical disorders. So these are disorders that require clinical attention and that we can help you with therapy, with medication, and we know we can usually make better in some way. Like if we find the right amount of medication, if we find the right type of therapy, we can help you, you can get better, we can improve your life. Right, so Axis 1 disorders are things like depression, anxiety, things that fall within anxiety disorders like obsessive compulsive disorder, post-traumatic stress disorder. Let's see what else falls under here. I think schizophrenia falls in here. Kind of our bigger types of disorders are Axis 1 disorders. Now, if you are diagnosed with an Axis 1 disorder, your insurance will almost always cover your medication for it and for you to have some therapy associated with it. An Axis 2 disorder this is like our next level. So first we're going to see, can we diagnose you with an Axis 2, and then we're going to see, do we diagnose you with an Axis 1, and then we see, do we need to diagnose you also with an Axis 2. These are going to be our personality disorders and things like mental retardation, which is a significantly low IQ score combined with an inability to take care of yourself, feed yourself, bathe yourself, things like that. So maladaptive personality traits and major brain developmental issues are going to be Axis 2. Now, these things we can't make better. I can't cause you to have a higher IQ with a medication. I can't change your personality. So an Axis 2 disorder is not seen as not as big, not as clinically needy as an Axis 1 disorder, but still there's things we can do to help you when you have an Axis 2 thing. If you have a personality disorder, we can help you through therapy and medication to have it not be as severe for you, to help you not have as many symptoms of it. If you have developmental issues, we can help you to learn how to, do things on your own a little bit more, things like that. But neither one of these things can be, quote unquote, cured. Now, if you're diagnosed with just an Axis 2 disorder, a lot of times you will not be able to receive therapy or medication through your insurance, especially if you have just a personality disorder, because your insurance says, oh, this isn't an Axis 1 clinical disorder, we don't have to cover it. And so it won't cover therapy for it, and it won't cover usually medication for it. So what us psychologists do is we get a little tricky and we will diagnose you with an Axis 1 disorder so that we can treat your Axis 2 disorder. So a lot of times you'll see people diagnosed with what's called depression NOS or anxiety NOS. And the NOS means not otherwise specified, and that's usually a diagnosis that those in the know mean that we really have something else we need to be helping you with, but we want your insurance to cover it. So we're gonna give you one diagnosis and really be treating you for this other thing. So that's a little fun, tricky thing that we do. Shh, don't tell anyone. It's a secret, even though I'm telling all of you. Alright, so Axis 3 is going to look at medical conditions that may affect your mental disorder. So are there other things going on that are affecting your anxiety, your depression, your eating disorder, things like this? Other medical conditions that maybe can explain what's going on. So we're going to want to do a full medical history with you as well and know what kind of medications you are on already, what other medical conditions you have. So that's the third part of our analysis. Axis 4 is going to look at your social and environmental problems that may impact treatment. So what is your housing situation like, your relationship situation like, your job situation like? Is this going to stop you from being able to get better? Is this going to prevent you from getting treatment? We're going to need to know about those things. And then finally, Axis 5 is we're going to be looking at your level of functioning in your daily living. So are you able to go to work, take care of your kids, bathe, right? These things. So, I could have two people that come in to see me that both have major depression, but one of them, still, takes a shower every day, goes to work, makes dinner for their kids, pays their bills, and is just suffering with depression, nonstop, but still is able to have that kind of higher level of global functioning, while the other patient may, not be able to get out of bed most days, doesn't bathe regularly, isn't able to keep a job, doesn't remember to feed their kids, right? Same overall diagnosis of both having, having major depression, but that global function is really going to tell me as the therapist what do I need to do for you? Like, how kind of hard do I need to be pushing for this, right? The person who can't get out of bed most days is probably going to need much more medical and medication type help from a psychiatrist or some other medical professional that I would refer them to than the person who is able to have, high global functioning and may also need medication for their depression, but probably not to the level that the other person would. All right, so the global function is really going to tell us how much is this mental illness affecting your daily life and your ability to just do, regular life skills. All right, so in the United States of America, we have 22% of our adults at any given time suffer from some sort of mental disorder. Major depression being one of the most common. I would kind of alcoholism usually is like the number one, because alcoholism, drug addiction, that falls under mental health disorders as well. So if you look at all of the people suffering from alcohol disorders, drug addiction and drug disorders, and then all the people that have depression, anxiety, and all of this, at any given time we have about a fifth of the population that's dealing with some sort of mental health issue. And then all of the other, 500 plus that are in that book, right? So it's a lot. It's a lot kind of going on. We need more therapists, that's for sure. All right, so here's kind of a list of the different things that people are dealing with and how many people in the United States have them. All right, so we are going to start our talk about disorders with anxiety disorders. So mental health disorders, like I said, are categorized into different types. So anxiety disorders are a type of disorder, and we have multiple different disorders within anxiety disorders. I'm not going to talk about all of them. I'm going to talk about a few of them, kind of the most common ones. But there's a whole bunch of disorders that fall under the canopy of anxiety disorders. So with anxiety disorders, the main symptom is going to be excessive or unrealistic anxiety. So when we're looking at the difference between like anxiety disorders and mood disorders, which I'll talk about next, we're really going to be focusing on what is kind of the main symptom. Now, our issue is that anxiety and depression are really closely knit, and so sometimes we can get it wrong and we can diagnose you with an anxiety disorder when what you have is a depressive disorder or a mood disorder, but luckily the treatment for them is pretty much the same, so it's not that big of a deal. So our main symptom is excessive or unrealistic anxiety. So why am I saying this again? Excessive or unrealistic anxiety. It's because anxiety in and of itself is normal. We're supposed to have anxiety. All right, think about when it's normal to have anxiety. When should you feel anxiety? What is something coming up maybe next week that may cause you to feel some anxiety? Yeah, maybe your final exams that are coming up next week, right? May have you feel anxiety. That's normal. When something that you're unsure about is happening, it should make you feel anxiety. Anxiety is your body saying, hey, look out, or be worried. Like, do we need to go into our sympathetic fight or flight response, right? We're supposed to feel anxiety at some things. However, when it's excessive, when we're feeling it all the time, even when there's not a cause that we can pinpoint, then we might have an issue. When it's unrealistic, when you're feeling anxiety about things that really shouldn't be causing you anxiety, then that is something that we say, okay, this is becoming a disordered way of having emotions. All right, we need to do something about this level of anxiety that you're feeling. So people that have anxiety disorders, that have this anxiety kind of pop up out of nowhere sometimes, or maybe they know exactly what causes it, but it's something that's unrealistic, like, a fear of heights, which we'll talk about, right? That to the point where they can't even go to the second story of a building, that's an unrealistic and excessive amount of anxiety that then becomes a problem. And when it becomes a problem, then we say, okay, then you may be suffering from an anxiety disorder.